Welcome back to the video. We can see here the extraction of Senile Comedones being performed very patiently, removing all the comedones one by one present around the eyes. Extra precautions required to avoid any kind of injury there. Wearing the gloves while doing the procedure, standard protocol. Helps to avoid the risk of infection and other complications. Easy removal procedure. Looks like the comedones are not tape-seated here in this case, and the hypopigmentation on the tip of the comedones is due to the oxidation process. Upon the exposure to the air, they turn black. All of the sebaceous material coming out along with the dead cells. The erythema at the site of removal, as you can see, is temporary and it is due to the pressure that is being applied here, and will go away on its own. Here's another one. We recommend to take extra care of the skin for the next 7 days after the procedure, such as not using harsh exfoliants, avoidance with direct sunlight, using of sunscreen, and gentle cleansers only, so that the skin gets recovered very easily. To control the amount of sebum, it is recommended to use salicylic acid based face wash. It reduces the amount of sebum on skin, but in case of deep-seated comedones and comedones like this, procedures are recommended. Few of the products that I recommend to use are given in the description if you'd like to check out. Here's another one. Site looks clean. Topical numbing cream in some cases is required where the pain threshold is low. There is a risk of contact dermatitis. I've seen in some cases after the application of PMLA cream. So only strictly in the cases where it is necessary, I advise to use that cream to reduce the sensations and amount of pain. After the procedure, topical antibiotic cream can be applied for few days in necessary cases where we suspect the risk of infection. You can see the open pores as well, along with pH, and here are the before and after results of the procedure. In case of any doubts, you can ask me in the comment section, and if you like the video, you can subscribe to the channel for more such coming videos. Thank you so much.